The shaft of the humerus is the longest part of the humerus. It is cylindrical and is compressed in an antero-posterior fashion, giving it a triangular appearance on cross-section and is roughened where muscles attach. Remember the rule of three. It consists of three borders known as the anterior border, the medial border, and the lateral border. Similarly, it has three surfaces referred to as the anterolateral surface, anteromedial surface of the humerus, and the posterior surface of the humerus. To identify these surfaces, you must remember this line, which is drawn as a continuation of the crest of the greater tubercle, and it also marks the anterior border. The area between this line to the lateral border will be called as the anterolateral surface, and the area from this line to the medial border is known as the anteromedial surface. The posterior area is the area between these medial and the lateral borders on the posterior aspect of the humerus. These surfaces provide muscle attachments, which will be discussed in detail in the upcoming sections of the muscle attachment. For now, we'll delve deep into the important anatomical landmarks present on each surface. On the anteromedial surface, the nutrient foramen is located here. The nutrient arteries of the bone enter the humerus through this foramen. Coming to the lateral surface of the shaft, you will find a roughened surface which is known as the deltoid tuberosity. This acts as the site of insertion of the deltoideus muscle. The deltoid tuberosity continues on the posterior superior aspect of the shaft as a crest, beginning just below the surgical neck of the humerus and extends till the superior tip of the deltoid tuberosity. This is where the lateral head of triceps brachii muscle is attached. The radial sulcus, also known as the spiral groove, is found on the posterior surface of the shaft and is a shallow oblique groove through which the radial nerve passes along the deep vessels. Now you have to remember that this groove is located posterior-inferior to the deltoid tuberosity. The inferior border of the spiral groove is continuous distally with the lateral border of the shaft. The radial nerve passes in this groove. A mid-shaft fracture in a patient may result in the damage to this radial nerve, which is a common type of injury related to the shaft. It presents as a wrist drop in patients in which the arm is adducted and pronated. Now, this condition is funnily known as the waiter's tip, as the position is similar as if the waiter is discreetly asking for a tip behind the management's back. Now, what are the bony landmarks of the distal end of the humerus? Switch to the next section to learn about this.